This is an old diagram that I still love to use with a lot of the patients because it explains something very important. We can stick a needle here in your blood and examine the blood, but often it doesn't tell what's wrong. We cannot stick a needle in here in the green or the yellow, the immune system or the nervous system, and find out what's wrong. And that's often where the problem exists. It's the memory in the immune system of dysfunction or the memory in the nervous system of dysfunction that's causing the functional problem to never get better. Here's where a lot of problems start, the memory centers of the deep part of the brain. If you notice, the eye is connected to this part of the brain, not just here. So what we witness in life, what we hear, smell, taste, is stored up in the central part of the brain. These are peripheral memory centers in the brain, and these peripheral memory centers hold memory that allow the organs to function normally or sometimes abnormally. If you get negative memory that starts here, goes down the nervous system, goes down the immune system, and gets stuck in these memory program centers called plexi, then you have chronic dysfunction of your vision or of your immune system in chronic sore throats or respiratory infections, heart palpitations, chronic lung troubles, stomach troubles, liver, colon, bladder, ovaries, or testes. The dysfunction is often because the yellow, which is the nerve program, has something wrong in it. That's the mystery. That's why you say, I've seen some of the best doctors in my town, but they've never discovered why I am not feeling well. Why is my stomach not working well? Why is my heart beating abnormality? We must get into electrical treatments that unfortunately cannot be measured with the lack of sensitivity of a lot of the tests that we do. So we do it clinically. We observe the person as they're talking, and we get them to talk about what's stored up in this part of their brain and what's stored up in this part of the memory center that's affecting their organ system. Once we understand that, and we get that out of these centers, and we get that out of these storage centers, your immune function is better, you're healthy again, your mind is functioning well, your seizure disorder has gone away, or your migraines have gone away, the back pain has gone away. Back pain is more from neural dysfunction than it is just for disc or structural dysfunction. If a good surgeon has fixed your structure, but the pain hasn't resolved, you try homeopathic medicine and see if the nervous system can repair, and often that pain from years and years can go away. If you have infertility, which is the lack of the connection between this part of the brain and here as stored through that plexus, if there's a blockage occurring there, fertilization, implantation, all the complexity of getting pregnant is blocked. When you begin to open these centers up again, then the blockage can go away. So it's an old diagram. It's one of my favorite diagrams because it tells you when you balance the nervous system correctly and naturally, you can return back to healthy function. And that's what we want to bring to the public.